Hey guys, welcome to another episode of Homework Review. This time we're going to be going over our cytology homework. And question number 1, name some reasons why cytology is important. So to establish a diagnosis, identify disease, decide direction of therapy, forming a prognosis, determining what diagnostic is next, and just remembering that we are evaluating the tissues. The main purpose of cytology is to differentiate neoplasia from inflammation. Number 3, how does a cytology slide prep differ from a blood smear? So we kind of dealt with this when we started doing blood smears, where when we first talk about it and you don't know any better, you just think, oh, I saw my doctor put a sample and smush it with 2 slides. Well, we know with a blood smear, you're going to put a dot of blood on the very end and wait until your sample goes across your slide and then push it away or pull it, whichever method works best for you. Whereas cytology, we're going to spray the sample, can be kind of in the middle or on the end, depending on your volume. And then you're going to actually smush your slides on top of each other and pull away. Whereas your blood smear, you're pushing across the slide. Describe the Romanowski stain and how to use it. So the Romanowski stain is our diff quick. So we have our light blue fixative, our pink that usually helps stain cytoplasm, and the purple that helps to stain a nucleus or other things. And generally the rule is you dip for 10 to 15 seconds into each color and then rinse and air dry. Make sure you rinse the back of the slide and not the front, so you don't risk rinsing off some of your sample. And this can be kind of subjective depending on your hospital or what your normal practice is. Some people say you need to be in the fixative for at least 30 seconds. Generally, if you're in each for the same amount of time is usually fine. And then remembering thinner samples need to stain shorter amount of time, and thicker samples might need to stain for a little bit longer. Number 5, what artifacts might you find from an old or contaminated stain? So bacteria is kind of our number 1 there. If it's just sitting at room temperature, it's a liquid for stuff to grow in. Precipitate's another one, so you might see some like little crystals or spots. Hair is something that can get left behind in there. And that's kind of important because to the untrained eye, you could think it's a parasite. And then maybe some other particles, maybe some other cells that got left behind. So it's really important to keep track of your stain and how often you're changing it. Kind of a rule of thumb is to clean it about once a week. Depending on your hospital, if you're really busy using it a lot, then maybe every day is a good idea. If you're not using it a whole lot, maybe you can do once or twice a month. So it just really depends on how much you're using it as well. Number 6, for each objective, list the total magnification and what we're looking at on a cytology film. So A is our 10x, which would be 100 times magnification. And this, we're looking for parasites, crystals, foreign bodies, fungal organisms, or increased cellularity. And by that, when you're looking at cytology, if you're looking at a specific type of cell, look for groupings on your 10x. And then later on, you'll know those groupings have a good amount of cells that you can zoom in on with your oil objective to get a better morphology later. Your 40x objective will be 400 times magnification. And you're going to evaluate individual cells with other normal cells in the smear. So it kind of gives you a visual of like, say you have some normal things here, but these are a little bit bigger, maybe abnormally shaped. So those are abnormal by comparing them to other cells. But really up to your 100x objective, your oil, or 1,000 times magnification is really where you're going to look at your cell morphology in detail. Number 7, list the classifications of inflammation. So we have eosinophilic, pyogranulomatous, so neutrophils and macrophages, purulent, which would be like plaster infection, so lots of neutrophils, and granulomatous, which is macrophages. Number 8, fill in the parentheses with the common name of the tumor and then describe it. So epithelial, we'll call carcinoma, and they are usually in groups of cells, and they're kind of like large, they have like a large cytoplasm. Mesenchymal are spindle cells, and also called sarcomas, and they're usually individual cells, and they have a thin cytoplasm that's usually kind of like stretched out. A discrete would be a round cell, and usually they're in individual cells, sometimes in groups. And then some examples would be like our mast cell tumors, lymphosarcoma, histiocytoma, or melanoma. Sometimes you can find that. Number 9, describe the difference between a mast cell tumor and a melanoma. So both of these are granular cells when you look at them, but the mast cell tumor is going to have purple granules, where the melanoma is going to have black pigmented granules. Number 10, from a tumor aspirate cytology, how can you tell if a tumor is malignant? So just not actually looking at the tumor itself, but looking at the cells, there's a couple little morphology things that you can tell that's not normal, and that's bad news. So if they're varying in sizes, if you have a larger nuclei, if there's a variation in nuclei, so some of the cells have a smaller nucleus and some of the cells have a larger nucleus. If they're multinucleated, so sometimes you might see a cell that has 2 or 3 nuclei in it. And then our mitotic figures. So you shouldn't really catch a mitotic figure on a normal cytology. So if you're catching it in a tumor, that means that it's going through mitosis very quickly, and that's not good. Because we know cancer isn't necessarily a disease per se, but it's the overgrowth of some kind of tissue, right? And number 11, what are some common problems that happen during a needle aspirate? So the tumor's too small, and you just can't get enough sample from a needle. Doesn't exfoliate well, so lipoma is one, where you might just get some oil on your slide, but not actually any good cells. A needle's in the wrong spot, so maybe it's a smaller tumor, or it's kind of a deep tumor, so you're sliding right next to it, not actually getting sample from the tumor. Or improper technique. So like say you pull the plunger back while the needle's still attached, and you're sucking that sample into the syringe, and you can't really quite squirt it out. So making sure that you take the needle off, then pull out your syringe, put the needle back on, and blow it. There's other different improper techniques, but that's kind of a big one. Why would you avoid sending a cytology slide in the same, it says bag as a formalin jar containing a mass? So formalin, even though it's kind of in a sealed jar, it still has like a gas that leaks out. And if that glass gets in contact with your slide, all those cells just kind of melt to nothing. So they just look like a smudge. Like those smudge shells that we look at on our hematology slides. Just imagine your entire sample is nothing but smudge. So when you are packing these samples, you need to make sure that the formalin has its own bag, and then your slides have their own bag, and they're sent separately. What are 3 different methods of insemination? So we have transvaginal, which is our kind of traditional, we just put the sperm into the vagina. We have our transcervical, so this is our specialty. My practice does it, but mostly other practices that do have endoscopy. So you're actually passing a catheter into the vagina and through the cervix directly into the uterus, and then injecting the sperm. And then you have surgical insemination, where you literally do an abdominal surgery and you cut them open and inject the sperm directly into the uterus and close them up. What is the purpose of vaginal cytology? Our purpose is to assist in the timing of breeding and to find where the bitch is in the estrus cycle, because we know that each part of the cycle has different types of cells. Number 15, describe how to perform a vaginal cytology. You're going to moisten a cotton swab with either like saline or just a little bit of water. And then you're going to insert it into the vagina because, I mean, we don't want to dry cotton up there, right? So moisten it a little bit, and it also helps with trauma when you're collecting the sample, and it's a little more comfortable. And then you're going to gently roll against the vaginal wall and making sure that you're not in too deep that you could possibly get to bladder cells, but also that you're not too distal, too far away, because then you're going to get false cornified cells, because it's exterior, just like our skin. We have like keratinized cornified cells on the outside, so we don't want that to fake us into estrus. So you got to have like that sweet spot right in between the two. And then once you collect your sample, you're going to gently roll it onto a slide, just like you would with the ear cytology, and it's going to air dry, and then you're going to stain it with your Romanowski. Name the stages of the estrus cycle and describe what types of cells you might find in each and how long each stage lasts. So for this one, I'm not going to explain over the phone. I hope that you guys got everything okay on the assignment, but we have this lovely chart that I made for you guys so that you have it as a reference. And this has all the answers to that question right here. So just briefly, proestrus is kind of right before the heat cycle. We'll normally see parabasals and intermediate cells and red blood cells. So red blood cells are your really big hint to proestrus. Estrus, we have those superficial cornified cells. Sometimes they're anuclear. And then we have our diestrus with some parabasals, some intermediates, some neutrophils, and that's kind of our pregnancy maintenance, where estrus is for breeding and diestrus is pregnancy maintenance. And then anestrus, the bitch is not receptive, it's parabasal dominant, and few to no neutrophils, no red blood cells, and this is kind of our dead period for 4.5+ months. If you have any questions on all that, let me know, but hopefully this chart should help you out. Why is it important to identify the type of epithelial cells in a vaginal cytology? And that's to know where she is at in her cycle. At what temperature should you warm equipment to evaluate semen? So hopefully it's the easiest to remember because it's the same temperature at which our culture plates incubate. So it's 37 degrees. So you're actually going to warm all of your equipment, your slides that you're going to view. Usually we'll do like a warm fluid bag to set the slide on top of. Your syringes, your like collection straws, everything that you are going to use to evaluate sperm, make sure that it stays at 37 degrees Celsius. What characteristics are you looking at to determine viability of sperm? So we're going to be looking at motility, morphology, volume and concentration, viability, and if any other cells are present. What objective to evaluate sperm? That would be our 40x objective or 400 times magnification. Number 21, other than the Knott's test and direct smear, what's another way to view heartworm microfilaria? So the point of this question was to get you to check out our lab handouts, and we get into heartworm testing a little bit there. But a cool way to look at our microfilaria is the Buffy coat. So you spin down your hematocrit tubes like you would normal, and then put it on your microscope at like a 5x objective. Of course, you can't get too close to it because it's big considering. And if you look at that Buffy coat, you can see little wiggles happening with the microfilaria. Number 22, when performing ear cytology, what types of structures are we looking for? And be specific. So we're looking for ear mites or Ododectes cynotus. We're looking for bacteria. We're looking for yeast or Malassezia pachydermatis. We're also looking for neutrophils. Number 23, what is a DTM and how do you use it? Our DTM is a ringworm culture in a jar or a plate. You're going to place the plucked hair from the edge of the lesion, and knowing that if you're trying to get something from the center of the lesion, then that's a healed area where the edge of the lesion should still have some live microorganisms. And you're going to press it into the agar, not to dent it, but just to get it seated inside the agar. And you're going to inspect it daily for 14 days. And usually you see growth within 4 to 7 days. You'll see some white growth, and then we know it's a differential media, so it changes color to red. And make sure it's at room temperature. Number 24, is a woods lamp reliable? Why or why not? So a woods lamp is not reliable because only some species will glow under the light, and there's also other artifact that can glow that is not ringworm. Number 25, describe how to perform a skin scraping. So you're going to have a slide ready with mineral oil, just a light little covering, and you're going to use a 10 blade, and you're going to scrape the skin. If we're looking for Demodex, and you're going to scrape until you see the capillaries bleed a little. And then you're going to tap your 10 blade onto that mineral oil and do a little spread with it if you need to. And then that's it. And you look at it under the microscope. And we're going to go into our terms. So histopathology is the evaluation of the architecture of tissues. So difference in like our cytology where we're doing aspirates and looking at the microscope, the histopathology, they actually have like this waxy substance that they, I guess you could call like freezing the tissue into, and they slice really thin layers and then look at it under the microscope. It's kind of cool. A transudate is a clear fluid, non-cellular, usually like a cyst kind of material or like a liquid cyst, not like a chunky cyst. And then exudate is a cloudy white or yellow fluid and it's very cellular, like an abscess. Neoplasia is a new abnormal growth of tissue, like a cancer. Mitotic figures is the tightly wound chromatin that's present with the lack of nuclear membrane. And the cell is undergoing mitosis, and this helps determine that a neoplasia is malignant. Benign is not harmful, not malignant, non-invasive. Malignant tends to metastasize or spread and can infiltrate other tissues. AI is artificial insemination. We talked about the different methods, so I didn't really need a whole lot of details there. Just wanted you to know the acronym. Progesterone is a sex hormone in the estrous cycle. Also helps maintain pregnancy, and it's produced in ovaries. Cornification is angular cytoplasm, like a chip, with little to no nucleus. Macroconidia is the spore of a fungus. Estrus is the in-heat section of or second stage of our estrous cycle. It is the reproductive cycle of mammals and recurring physiological changes induced by hormones or a cycle. Stay tuned and I'll have the video of our pictures and then some other review pictures as well.